This video will demonstrate a minimally invasive hamstring tendon harvest using the looped mini-tape suture and the X-Wing platform. Hamstring tendon autograft ACL reconstruction are used predominantly for non-collision athletes who wish to return to cutting, pivoting sports, and those who prefer to avoid any risk of anterior kneeling pain, sometimes caused by bone-patellar tendon bone autografts. These patients also accept some slight post-operative hamstring weakness. When choosing a soft tissue graft, the literature dictates that diameters less than 8 millimeters are more prone to re-rupture and early revision, and this is published by the Moon and Mars study groups. Thus, with the 4-stranded hamstring autograft, we aim for at least 8 millimeters of diameter. The gracilis and semitendinosus tendons are part of the PEZ complex and easily retrieved in the following manner. Estimating 2 to 3 finger breaths distal to the medial joint line and 1 finger breath medial to the tibial crest, along with the trajectory of the hamstring tendon insertion, a 3-centimeter incision is made through skin and subcutaneous tissue. And this is done until sartorius fascia is identified. The 2 tendons are then palpated to confirm correct location. A transverse incision is then made superior to the gracilis tendon. A metal retractor is then used to separate the plane between the 2 tendons and the fibers of the distal MCL. This fascia can then be reflected off the bone to complete what looks like a hockey stick incision. Once reflected, the smaller gracilis superiorly and the semitendinosus inferiorly and larger can be seen. Careful separation must take place between these tendons and the distal fibers of the MCL. As you can see here, the semitendinosus and the more superior and smaller gracilis tendon are seen. Following this, the 2 tendon ends have their adhesions separated from them, and each tendon is tagged with a number 2 suture. The next step to remove any adhesions to the gastrocnemius medially is essential to prevent premature graft harvest or stumping of the graft. One trick is to watch the movement of the medial head of the gastrocs to ensure the adhesions to the tendon have been separated. As such, once removed, the medial head of the gastrocs should no longer be mobile when each tendon is pulled. Once confident, a tendon stripper is used to retrieve each tendon. When harvesting the gracilis, the stripper should be directed toward the pubic symphysis. The tendon stripper is then advanced until the myotendinous junction is reached. In the same manner, any adhesions are then again checked and removed from the semitendinosus tendon. And for the semitendinosus harvest, the direction changes to a more posteriorly directed toward its origin at the ischial tuberosity. This technique demonstrates a minimally invasive 2 hamstring tendon harvest with the incision positioned nicely for the tibial drilling. The X-Wing platform provides a reproducible way to prepare and pre-tension your soft tissue graft of choice.